Please join in. We have started. Hello, hello, hello. Join in, please. Okay, so let's start. I hope I'm audible, visible. Chalo, let's start. So I hope you had nice lunch or whatever you had. So let's start the next rocking session. So I ate methi. I hope you know methi. Methi is a green vegetable and it's very good for health. Not good in taste. You all know it is not very tasty, but first priority is what? Having health rather than yes. So let's start. Let's rock. Let's other also join in. Yeah, yeah. Iron is also there. See, iron. Also, it contain yes some carbs, some proteins, and lots of fiber. Lots of fiber. Fiber, fiber, fiber. You chew fiber, fiber, fiber. So I'll show you the photo of methi. See, this is methi sabji. So I hope you can see this one. Methi. Okay, very healthy, very good for your health, gut health. It is fenugreek. Yes, it is fenugreek. Now you'll be able to remember. This is the methi. Okay, fenugreek methi. So are you clear? So this is methi. They cook. Yeah. I don't eat roti much, so I just take salad with this. That's it. Oh, it's not spinach. Spinach is palak. It is this. Okay. Chalo. So let's continue. Methi. Oh, Ruchika, very good. I love actually green fruits, vegetables. That's part of my diet since beginning. Okay, so I love to eat fruits. Love beans. I love spinach, saag. Like mustard, saag, broccoli. Okay, all this. Okay, etc. So these are my favorite foods, and they are what I prefer to eat. Okay, Chalo. So we are starting CVS, and in the CVS, what we are going to do and learn is basically yes. So please open the file. Okay. So page number is our 27 as per the new book, and I think 100 and some 8 or 9 as per the old book, 119. Okay. So we are discussing membrane physiology, okay, in which we'll discuss RMP and the AP. And this is chapter number 6, but it's a part of both CNS and CVS because we are studying the membranes of the excitable tissue. So please join in. So first question. Understand the theory that the membrane of excitable tissue, example, the muscles and neurons are selectively permeable. They are selectively permeable. What that mean? Means at rest, membrane is permeable. Membrane is permeable to what? To potassium and chloride, and that's why they are called as diffusible ions. Which ions? Diffusible. So what they are called as? They are called as what? They are called as our diffusible ions. Okay, but not permeable to other ions. But not permeable to, madam, to sodium, calcium. Proteins are negative. Phosphate, etc. So they are indiffusible ions. Indiffusible ions. Now, because the indiffusible cannot cross the membrane, but they have the charge, this will cause a uneven, unequal distribution of what? Of our diffusible ions also. So what happens? There is going to be uneven or unequal distribution of what? Of the diffusible ions also. Are you clear? So remember, due to presence of indiffusible ions, mainly intracellular proteins, there is uneven distribution of diffusible ions also. So this is called as Gibbs-Donan equilibrium. So now let's see Gibbs-Donan equilibrium. So understand the total charge has to be equal. That is, cation should be equal to anion. But what doesn't matter is which cation is this. So nature want cations, which is plus, to be equal to anion. This is what is called as equilibrium. Are you clear? So what does equilibrium means? The cations are more, less, or equal. They are equal. But what is not equal? Individual ion is not equal. Let me explain. Okay, understand. Can the sodium calcium come inside? No, they are indiffusible, so they are more outside. So they are indiffusible outside. So what are they? They are indiffusible outside. Indiffusible outside more. Are you clear? Now, as a result, second, the phosphate and proteins, they are indiffusible inside. They are inside more. So now what happens is, understand, is potassium diffusible? Not diffusible. So potassium is diffusible, not diffusible. It is diffusible, permeable, but it should be equal. Like potassium should be 50 here, 50 here. No, then the total plus will become more outside because already plus is high. So to balance the charge, where should potassium be more? It should be equal or it should be more inside. What do you say? Equal or more inside? So more inside. So that's why potassium is more inside. Why? To balance the indiffusible sodium calcium outside. Same way chloride is diffusible. Should it be equal inside outside? No. It will be more inside. More. So this phenomena of ions either more in the cell or more outside the cell is called as our which phenomena? It is called as our which phenomena? It is called as, it is not on YouTube, Mohan. This class is occurring in the app. Okay, so it is an app, not on this. Okay, please check NLC app. Okay, so chloride is more, sorry, outside. I got distracted by this message. Is more outside. Yes. So this is called as Gibbs donor. So let me give a comparative example. Then we will move. So first question. Are the ions equal or they are not equal? They are not equal. Where is sodium more? Okay, let's do a revision. So you know my nature. Okay, first I will say, okay, okay. So I'll just first take a question. This photo I need. Why? I'll tell you. Okay. So first is, tell me, are the ions equal, not equal? So ions are not equal. Are you clear? They are not equal in ICF and ECF. Some are more inside, some more inside, some more outside. Are you clear? Okay. It is not taken in YouTube live. Okay. It is coming in NLC app. Okay. Class is only NLC app. Okay. So please take NLC app and watch it there. It is streaming there. Okay. Demo class was there for all of you to watch, but again, it's a NLC class. Okay. You have to, yes, join the NLC app. Okay. Chalo. So now some ions are more inside, some are more outside. So now what is the result? There's an uneven distribution. Now let me give an example. In a train, there are two kind of seats, upper berth and lower berth. Upper and lower. Are you clear? In the train. Now let's say there are 100 upper berth and 100 lower berth in the train. And now young and old people enter this. Okay, clear? They are both live and recorded. Okay, you can watch it later. Okay, live now. Okay, so now comes the question. Okay, if let's say 100 people enter the this. Okay, now let's say there are 100 young people and 100 old people. So what is the ideal choice? They will be 50%, 50%. Are you clear? So 50% lower berth should be occupied by young and old, and 50% should be young and old at the upper berth. Are you clear? That is ideal equal distribution. But you know, older people, they are indiffusible. They cannot climb up. So which seat they will occupy? So they will occupy the lower berth. So when you enter, a old person is already sleeping on your berth. You are a young person. You say, uncle, auntie, this is my seat. So what the old person say? Son, I cannot climb up. I am a old person. You climb up. तो क्या बोला? बेटा मेरा उम्र हो गया, मैं चढ़ नहीं सकता ऊपर, मैं इंडिफ्यूजिबल हो गया हूं. यू चढ़ जाओ ऊपर. मेरे ऊपर नहीं, सीट के ऊपर चढ़ जाओ. ठीक है? एंड दैट इज व्हाई व्हाट द एक्चुअल पिक्चर. दिस इज नॉट द एक्चुअल पिक्चर. For the actual picture, the lower berth are maximally old people and upper berth are maximally young people. So that's why there's a equality or inequality. So seats are filled. All the seats are occupied, but they are occupied by, yes, different age group. Younger people, upper berth, older people, lower berth. Have you understood this? This is called as our Gibbs-Donan equilibrium. Some ions are more inside, some are more outside. So this inequality, what the reason? What the reason of this inequality? It is the presence of which people? Old people, young people, old people. So old people are indiffusible, and because they cannot diffuse upward, so they are indiffusible. So they will occupy one space, and as they occupy that space, the other ion like potassium chloride have to go to the other side. So have you understood the Gibbs-Donan? Because if you don't understand this now, the remaining concepts of RMP, AP will be very difficult for you to understand and yes, get it clear. Are you clear? Okay. So now let's move to the next concept. Tell me where is what more. So tell me who's more in ICF, who's more in ECF. Okay, let's start. Where is sodium more? Where is sodium? Okay, Mohan, I'll repeat. Okay, so the idea is if a ion is more in the cell, okay, it will create its charge, and to balance the charge, the other side, other ion will be there. Are you clear? So that is why ions are uneven. Example, sodium is more where? In the ECF. Why? It cannot enter the cell. It is indiffusible. Have you understood this more? So the ion, which is the ion, which is what? Which is sodium. It is indiffusible, so it's more outside. So it's indiffusible outside. Now, if too much sodium accumulate outside, it will create plus, 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 plus. To balance the plus, which ion should be more in the cell? Which ion should be more, chloride or potassium? Tell me. Where will chloride be more and where will potassium? Potassium will be more inside. To balance what? To balance the sodium, and to balance the plus of the sodium, chloride become what? More in the ECF. Are you clear? And finally, where is calcium also more? Again, calcium is also more inside. Will you remember this distribution? Yes or no? So where is sodium more? Outside. Calcium outside. Chloride outside. Where is potassium more? Inside. So once again, potassium more inside and sodium, calcium and chloride more outside. More outside. Are you clear? Done? So that is our main story or main funda. Have you understood? Now I'll ask you another question. Okay. So I hope this inequality is clear. So this is called as what? Gibbs. So Gibbs is inequality. Inequality of ions. So once again, ions are equal or they are unequal. They are unequal. This inequality of ions is given the name of Gibbs-Donnan equilibrium. What is it called as? Gibbs-Donnan equilibrium. Now comes the very, very important point. Okay, like where are Russians more? In Russia. They are in Russia. And where are Indians more? They are in India. And this is the flight or this. So where will Russians want to go? If you give them visa, if you open the visa, so where will Russians go? The Russians will go to India. They will come to India and they will go to Goa. Are you clear? They will go to India. And if Indians are given visa, like now Russia is planning to give visa free entry. So where will Indians go? Indian will go to the Russia, clear? And that is the case. So that is the story. So everyone want to go from higher place to a lower. So Russians will go to India, Indians will go to Russia. Already they are going, not Russian, they will go to Russia. Sorry, wrong arrow. Indians will go to Russia, not Russian, Indian. Yes, okay. So this is the same concept you will apply. Okay, if you open a sodium channel, where will sodium go? Obviously inside. And where will the chloride go? Inside. Where will potassium go? Outside. So due to unequal concentration, the ions would move along their electrochemical gradient. Along what? Along their electrochemical gradient. Okay, electrochemical till what? Till they reach equilibrium. Till they reach equilibrium. And this potential is called as what? It is called as equilibrium potential, and it is given by Nernst equation. What is it given by Nernst? Example, where will sodium go? Sodium, calcium. Example, sodium, calcium chloride will come inside, will come inside, and potassium will go out. Okay, so it will go outside. Are you clear? So what will come inside? Sodium, calcium chloride will come inside, and potassium will go out. Now let's calculate the formula for Nernst equation. So the formula for EP is RT by ZF ln concentration gradient, or we can use another formula, or it can be written as plus minus 60 60, okay, log concentration outside divide by concentration inside. Now let's see the EP values. So EP values, you don't have to calculate. They don't ask you to calculate. I'll tell you. So let's see sodium. EP sodium is plus 60 millivolt. Now why? Let me explain. First, sodium is a cation or anion. So what is sodium? Sodium is a cation, that is plus ion. Sorry. Plus more where? More where? More. It is more in which area? In the, yes, ECF, more outside. So it will come inside. It will come inside. Are you clear? Now as it come inside, as sodium come inside, what is going to happen? So as the sodium come inside, it will create what? It will create a positive charge. It will create a positive. Okay, so it will come inside and cause gain of positivity inside. And that is why it create which EP? Hence positive EP. Hence positive EP of plus 60. Okay. Now let's see the EP of the chloride. So EP chloride is reverse. It is minus. Don't worry, I'll make it clear. Trust me. When I will give the summary, you say, oh, sir, so easy, sir. Sir, first time in the life, we are understanding action potential, RMP, EPSP, IPSP. Otherwise, they all go above our head. So now, write EP of potassium. So EP potassium is equal to what? So EP potassium is minus 90 millivolt. Why? Let me explain. It is again a cation. So potassium is cation, is a positive ion, but it is more where? More where? More inside. So where will it go? So it will go outside. It will come outside. And as it come outside, it cause a gain or loss of plus inside. And that's why create what? Create negative EP. Create the negative EP. So now I will teach in my style and you will say, okay, sir, finally we have understood. So write like me. Let's say this is your cell, or this cell is like your bank account, is like your bank. And this is ECF. Let's say I am here, Ashish sir is here. So if I give you some money to your account, let's say I give you 60 rupees. This is like sodium. So if I give you 60 rupees, what will be your new account balance? How much will it be? It will be plus 60 and mine will be minus 60. So first question, If I give you 60 rupees, I Paytm you or GPay you, what your account become plus 60? My will be minus 60. So first question, which is the right statement? Both are right, na? You are plus 60, I am minus 60. Both are right. Like I say, I passed the exam. I did not fail the exam. They are same things, na? I passed and I didn't fail are same. So should you write both the statement? It looks stupid, na? Like I went from here to you 1 meter means I went from there to you minus 1 meter. So that is why writing both is stupidity. We have to write one of the value. So which is the unit of life every living thing made up of cell? So which value should you accept and write both, or which value is preferable? This we will not write. Reason, cell is the unit of life. So that is why for sodium we write plus 60. Why? It is not because it is creating plus 60, but because it is creating 60 inside minus 60 outside. So we will write both the value. No, we only select one. Like example, okay, what I should say to people, I passed the exam or I did not fail the exam. So obviously I say did not fail. He say, why you are saying this negative? Say you passed the exam. Okay. Now second situation. Okay. I say, can you people give me some money? Say yes. Okay. So you say, give me money. This is potassium. You say, how much money, sir? I say nothing, just 90 lakhs. So if you give me 90 lakh, what your account become? Minus 90, my become plus 90. But problem, what you will report? Ki sir got 90 lakhs or I lost 90 lakhs? Tell me, which value we will say for potassium? Both are right now. But what is a better answer? Potassium minus 90. So that means if your account was 1 crore, now 10 lakh is left because 90 lakh I got. If your account was 2 crore, now 1.1 crore is left. If your account was 0, now you are in the loan or debt of 90 lakhs. You got the idea? So that's why first concept. Have you understood the EP concept? Yes or no? So loss is minus, lost is minus. So tell me all of you, have you understood the EP concept? So let me ask you. So is the EP concept clear to you? That why it is positive or negative? Very simple. If I give you money, you are plus. If you give me money, I am plus, you are minus. So easy. Yes or no? Now, are you ready to give NEET PG questions? Are you ready to solve NEET PG questions? Yes or no? Can you solve NEET PG questions? Yes or no? Why? Because I tell you, NEET PG is only solvable if you get the concept. Okay. So let me ask you a question. Okay. Let's say I have less money. So I will ask you for more money and you have to give me more money. So let me give an example first. Right. First scenario. If there is low potassium in ECF. Anyone, what is it called as? What is low potassium? It is called as hypokalemia. It is called as hypokalemia. So now if there is hypokalemia, what will happen to potassium? Will potassium come same, more or less? So dash potassium can come out less or more. So what potassium can come out, less or more? I don't have any money. I'm bankrupt. I say please give me more money. अरे बाहर कम है यार. If there's less, outside money is less. So now from inside, less or more? More आएगा ना यार. Why? Because outside is less, so there is more gradient. Are you clear? Understand? That's why I'm saying no, it's not easy. ये NEET PG questions हैं. So more potassium can come out as there is less outside. Are you clear? I'll give you example because I am someone who's very stubborn. Understand the concept. I have, let's say, I need 100 rupee. I need 100 rupees to pay to Ola Uber. Are you clear? I have 10 rupee. I have 10 rupee. Okay. So I say, can you give me 90 rupees? So you give me 90. So your account become minus 90. Are you clear? So how much money I ask from you? I ask you give me 90 rupees. So you give me 90 rupees and my account become 100 rupee I pay to Ola. Now my account is reduced. I lose this 10 rupee. I only have 5 rupees. That is, now I have low potassium in my pocket. So now I will ask you to give me what? 90 rupees or 95 rupees? Tell me. Now you will give me 90 or 95. I have only 5 rupees. Please, 5 rupees. Tell me. Now you will give me less or more? More. Now you have to give me 95 and you will become minus 95. Are you understanding? That means now you have to give me ECF more money because it is less there. So that means more potassium will come out. Are you clear? So more potassium can come out, and if more potassium come out, it will create less or more negative EP. More negative EP. More. What is the English word for more negative? More. Called as hyperpolarization. So the word is hyper. Hyper is more. So once again, hyper is more. Are you clear? Bacha, ECF and serum is same thing, na bhai? What is outside the cell? Interstitium, plasma, blood, all are part of ECF now. So, are you clear? Now do the reverse. If there is more potassium in the ECF, what is it called as? Hyperkalemia. So now I have more money. Let's go back to my example. Now let's say this time I have 20 rupees. I have 20 rupees, more money. So now I asked you to give me how much? Give me how much? Give me 90 rupees or just 80 rupees? You say just give me 80. So now you give me 80. So now you will be what? You will be minus 80. So this is what? More or less negative? Less negative. So hyperkalemia will cause less negative. So now less potassium will come out. So that's why less negative EP. Less negative EP. Call as what? Call as depolarization or hypopolarization. D means decrease. D means decrease. So now it is decrease. So less negative is depolarization. Less. Okay. This was your NEET PG exam question. This was the NEET PG 2023. What is more potassium cause? Hyperkalemia cause more negative membrane, less negative. The question was like this. I will give the exact question. Come and see. Question was if hyperkalemia occur, option was membrane becomes more negative, less negative, same, zero. So again, I'm telling you, this question you cannot solve by mugging, but if it comes, you will be very thankful, sir. Thank you very much, sir. You did this question with us already, and it came already in our exam. The answer is less negative. The answer is less negative. Or if in future they ask you depolarization, this is hyperpolarization. So I hope it's clear now. Okay, very good. Preeti, Christy, Rajgupta, Kana, Prabhakaran, Vignesh, Akhila, Venkat, Sai, Siva, yes, FMG, Ruchika, Pratik, Mano, yes, Kiran Thakur, very good. Ria, Masood, Pratik, Ruchika, Ria, Sumi, very good. So this was your NEET PG question, and I'm telling you, only place where you get NEET PG done. NEET PG PYQs. Tell me which is the place. Only in what? Which class? Yes, only NLC. Only NLC. And that's why the results will be best. I'm not joking. You can ask your friend preparing from any other source. In fact, most apps they reduce the content and the teacher will just make it very light content, especially RR. Students who are doing RR, they will not even cover FMG PYQ. So how will you expect you will get this kind of questions clear? Okay, no teacher will be covering these kind of questions. That is the case. Chalo, let's continue. Now let's see the EP values of the remaining ions. Okay, so right here, so EP calcium. See, understand, can you? Serum means ECF, ICF. Serum means ECF. Membrane is the difference between ICF and ECF. बच्चा ये देखो ना, आपका ECF मतलब outside cell. It could be serum और plasma एक ही बात है बच्चा. Serum is plasma without the clotting factor. So that's why serum plasma is same thing. Okay, so don't get confused. ECF means serum or plasma or blood all are same. Okay? Like India is what? Hindustan, India is Bharat, India is our country, my motherland. सब एक ही बात है. चलो. EP calcium. So EP calcium is what? Tell me first. It is similar to what? It is this was plus. What's the reason? It is similar to sodium. Similar to sodium. So it is similar to which? It is similar to our sodium. Similar to sodium. That is, it will be positive. So it's a cation coming inside. Cation coming in. That's why it is positive EP. Okay. EP chloride, I need your help. Tell me. Chloride is a cation or Manu, I'll discuss it later. Okay. Just have some patience. Okay. चिंता मत कर मेरे भाई, थोड़ा सा टाइम लगेगा but it'll be clear. But just remember, yes, not just sodium but even potassium can cause depolarization. Are you clear? So it can cause D. मुझे पता है भाई, I know this is D. Can you see? I will discuss it. Just have patience. It'll be clear. Okay. So EP chloride. So chloride is already anion and it is more outside. It will come inside. So that will create negative. So minus 70 millivolt. Why? Reason? It's a cation or anion. It's anion already negative. Coming here. Coming inside. That's why it will create a negative EP. So that is why it is a negative EP. So let's see EP values for summary. Sodium is plus 60 millivolt. Calcium is plus 100 millivolts. So please remember these two are what? First, they are positive EP and they are diffusible, indiffusible. Indiffusible ions. Then chloride is minus 70 millivolt. This is minus. These have negative EP and they are diffusible ions. Are you clear? Have you copied this? Please remember it because without this statement you cannot understand other concepts. Okay, just a minute, I'll get my water and come. 1 second. Okay. Continue. I got my water. Okay. So let's start. Let's rock. Okay. So now we see the concept regarding the summary here. Okay. Now there is a concept called as resting membrane potential. What is that? First, it is potential across the membrane at rest. Like we take a cell. If you put a voltmeter, this is a voltmeter, this potential recorded inside outside, this is ICF, ECF. This is called as RMP. So first question, what is RMP? RMP is the potential recorded across the membrane. Canal, it's going out. Again, if you give me money, your account become negative. It is not negative. You have lost money. Are you clear? Plus minus is not the charge. It is the sign change due to the loss. Are you clear? So you don't say I have now got negativity. You say I lost the money. So now my account is minus 90. 100 minus 90, you left 10. 10 means what? You are 90 below your previous value. Understood now, Kenneth? So don't say it is negative. Cation is not negative. Is the loss of cation cause a loss of positivity that is recorded as negative charge? Okay. Chloride is more in ECF now. That's why it come inside. See, I told you. Where is fluoride more? So chloride is more outside. It come inside. If it come inside, it cause negativity in the cell, and this is why we write it as negative. I think we need to learn this once again because I know every person should get it perfect. So tell me. What is the positive EP ions? Which ions have positive EP? Tell me. Which ions have positive EP? And have patience. Yeah, phosphate will be positive, Masood. So tell me, what is the EP? Positive, positive. Sodium, calcium. So they make plus. They make plus. Please remember it. Otherwise, you will not be able to understand the concept. Okay. Okay. Very good. Then what have the negative EP? Negative EP. Negative. Very good. Very good. Ishrat, Sumi, Kana, Volkan, Christy, Preeti, Venkat Sai, FMG, Jimit, Raj, Ruchika, Joe, Vignesh, Akhila, Tweety, Abdul, Riya, Vin, Jimit, Pratik, Ruchika. Very good. Kanil Bhatt, Abhay, Sayyed, Dr. Hana, Aziz, Abhay. Very good. Shabash बच्चों. Akhand Pratap. Very good. Sumi. Very good. Very, very good. Shabash. Negative EP will be chloride and potassium. Now remember, why potassium? Why potassium? Potassium is plus but going out. Chloride is negative but coming in. It is negative coming inside. Will you remember this? Because without this, the next chapter, next topic is almost impossible to solve. Okay, done? Okay, understood now? Now, first question. What is the potential across the membrane at rest called as? It is called as the RMP. What is it called as? It is called as our RMP. It is membrane at rest. So potential across membrane at rest is called as ion. So first question, what will RMP depend on? So it depends on ions and which ions membrane allow. RMP depends on, so RMP depends on the EP ions and membrane permeability. P. Now first question, is membrane permeable to sodium at rest? Yes or no? Tell me. Sodium want to come inside. Sodium want to come inside. But is it allowed? Not allowed. Not allowed. It's not permeable in diffusers. Remember, sodium has no role in RMP as it is indiffusible ion and membrane is not permeable at rest. So sodium at rest. So do a maths also. What is the value? So EP. So EP is plus 60 millivolt. If you multiply with 0, what will the maths give you? It will be 0. So that's why sodium has no contribution to the RMP reason. It has a 60, but the permeability is this. So this is what? This is EP sodium. And this is permeability of sodium, which is 0. That's why what is 0 into any number? 0. So sodium has what role in the RMP? No role in the RMP. Yeah, it's indiffusible. नहीं बच्चा रुचिका, ये तो मैंने शुरू में आपको बोला था, तभी तो कह रहा हूँ, the entire story why people have difficulty understanding physio or hate physio. I have seen almost 80-90% FMG, they hate physiology. You know why? They are not able to wrap their brain around the concept. कि why this, then this, then this. They say, अरे leave it. We'll just mug up कि sodium cause no RMP A and potassium. I discussed in the beginning itself. Membrane is not equally permeable. Membrane allows some and don't allow some. Are you clear? So that is why at rest, which are diffusible, potassium chloride. Which ions? Potassium chloride. Okay. It is indiffusible. Yeah. Yeah. As it is indiffusible. 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 Sorry. Okay. I thought I wrote here it is not diffusible. मुझे लगा था यहाँ होता है. Okay. It happens with my end. So as it is not diffusible. Okay. Yeah, indiffusible. Okay. Sorry, Ruchika. Okay. I uselessly gave you too much knowledge. Sorry. So I hope it's clear. Yeah, you are right. So sodium has role or no role. So it has role, no role. That's why it doesn't have any role in our RMP. Okay. Yeah. So what happens is sometimes when I'm teaching, my brain is occupied with looking at the chat, not one but two chat. Chat of the app, chat of this thing. I'm looking at double chat. One is the chat of the class, one is the chat of the Telegram group, plus screen also, and plus have a track of any other message from WhatsApp also. So that's why sometimes it becomes difficult. Okay, check. Let's continue. Which ions are permeable at rest? Which ions? Which are diffusible? Potassium and chloride. So which ion will be able to move across the membrane at rest? Potassium and chloride. So RMP will be caused by all the ions or these ions. Remember? Very good. So at rest, membrane is permeable. Is permeable to potassium and chloride. So they will be the cause of RMP? Which ions? Diffusible. Second, they both have positive or negative RMPs. They both have negative RMPs. They both have negative EPs. Okay, 70 and 90. So hence RMP is always negative. Always negative. And at rest membrane is most permeable. Which ion? At rest membrane is most permeable to potassium. So hence it is the main cause of RMP. So what is our main cause or main reason of RMP? It is our potassium, which is the main cause or main reason of the RMP. Are you clear? Done? Potassium. So clear? Potassium. Okay, one more thing. This was your NEET 2020. Again, this was one of the questions. Now, are you ready for some questions? Yes or no? Okay, so let's start. Okay. Question is, a cell is not permeable to potassium chloride but permeable to sodium. So RMP would be at rest. So RMP would be three options: A, negative, positive, zero, or cannot be measured, can't be estimated. Let's see who give the answer. Okay, so let's discuss. First is, it is not permeable to potassium. I said na, a cell, a cell. Okay. First question to this. So that's why they have no role. That means cannot be negative. So it cannot be negative. Not possible. Reason, potassium chloride has no role. But it is permeable to sodium. That means sodium will be able to move or not move. What do you say? Will sodium be able to come inside? Yes. So sodium will come inside. And what sodium entry create? Positive. So the voltmeter will record a positive charge. Are you clear? So the answer will be positive. Okay. Answer will be positive. Okay. Because now you are permeable to sodium, not to other ions. That's why RMP will be yes. It will be this. अरे लिखा है ना, a cell, not normal neuron. It's written a cell is not permeable to this, but permeable to. बोल रहे हैं ना permeable. बोल तो रहा है word. Look at the word ना. They are saying permeable. Understand ना? What potassium chloride want to do? Negativity. एंड सोडियम वांट टू डू पॉजिटिविटी. तभी कहा बार बार मैंने आपको रिपीट किया, ये याद कर लो, ये याद कर लो. मैंने 1000 बार बोला सोडियम कैल्शियम पॉजिटिव, सोडियम कैल्शियम पॉजिटिव, सोडियम कैल्शियम पॉजिटिव. Potassium chloride negative, potassium chloride. In a normal neuron, our body neuron membrane is permeable to potassium chloride, not to sodium. That's why our RMPs are negative, not positive. They are saying a cell is reverse. It is permeable to sodium and calcium or sodium, but not to the potassium chloride. So their RMP will be what? Same or reverse? RMP will be reverse positive. Have you all understood? Those who said zero or negative. Have you understood? Everyone, tell me. Because I'm telling you, it's not easy to pass the exam. If that would have been the case now, none of the FMG would even be attending classes. They will just buy some books, some MCQs, read them like you do in your colleges. Okay, don't feel bad, but I know how you people prepare for your college exam. Okay, clear? You have some set of question which you do multiple time, and the exam questions are mostly from those questions, and you are able to pass the exam. It's not difficult. You don't even have to apply your understanding to this. YY is again very easy. They don't even know English properly, so whatever English you speak, they understand, they make you pass. Okay, maybe one or two colleges have strict exam. Okay, I know one or two, like Philippines was good, Moldova has very strict, but again most places they were not sincere. That is why I am working hard to make you understand. People who do classes and do very well in FMG exam, they get PG seats also. Now you know Dr. Shaurya, he is doing ortho from a government seat. Reason? He worked very hard and he's a sincere student. He worked. Okay, chalo. Are you ready for next question? Okay. A cell is, next question, not permeable to any ion at rest. A cell is not permeable to any ion at rest. What will be the RMP? Tell me. Very good. The answer is 0. This time all of you got it correct. The answer will be 0. Very good. Very good. Dr. Akhand Pratap, Abhay, Ahmad, Sayyed, Atif Kadri, Kanil Bhatt, Kiran Thakur, Niranjan. क्या बात है. Very good. Dr. Ruchika, Christy Samuel, Vignesh, Kana, Venkat, Mazhood, Riya, Venkat, Sai Shiva, Akhila, Prateek, Jimit, Abdul Rakib, Prabhakaran. Very good. Dr. Sumi, very good. Perfect. So I hope now you are feeling good that we are learning these things rather than ignoring. Most students, when they find a difficult topic, what is their first reaction? वो जा रहे हैं ऐसे पहाड़ आ गया. So what is the first reaction? Okay, leave it, take other route. So they will skip and take some other, and that is the case. But my approach is different. My approach is what? Let's do it piece by piece. If you make this mountain like this, see, I'll teach you the secret cheat code. See. Now tell me, does this mountain look very tall or now it is manageable? It's like just walking. Can you see? It's like walking. Slightly you go and you can reach the top. Done. So now it is easy. So what a teacher do is, teacher doesn't do anything. He just make the concept simpler, and that make your journey much easier, much simpler. Are you clear? I'm not changing the height. The height is still the same. What I've done is I have made it much easier to climb. I don't want to skip the concept. It's a difficult concept, but by example, train birth, Russia, India, plus other example, give me money, loan. Remember, Ola, taxi. You have understood the concept. Once you understand all these questions are solvable, and rather than losing 1 or 2 marks in the exam, remember 148. You got 2 questions wrong. Which one? ECG. Why? You don't like ECG and your ECG is wrong. Or one was physiology, some membrane potential, you got it wrong. Or some diagram of histology. So if you do them, the reason is the chances of passing improve much more. Same way, do acid base, again the chances will increase. So the topic which are confusing, difficult, and they are mostly in physio medicine. Am I right? Most confusing topic, difficult topics are not in surgery OBG. Surgery is what? Point to point. If this condition, do this, do that, act me, ought me, done. But medicine is like If this, then this. If this, then this. Otherwise this. If this, then that. This, then this, then this. And you are like, kya hai ye? This is surgery. This is surgery. Okay. Yes, this is surgery. And this is medicine. This is medicine. That is why people hate medicine. It's so confusing. कभी बोल रहे हैं valproate दो, कभी कह रहे हैं no ethosuximide. No, if the age is less than this, then you give etho. Oh, if there's having a atypical feature, then you replace with valproate. Ah, if she's pregnant, इतना ज्यादा दिमाग की दही कर देते हैं मेडिसिन वाले. So that is why people prefer to do surgery but not do medicine, क्योंकि ये medicine है. Complex web full of confusing point. Okay, even one word changes the answer. One word. Patient has this with asthma, answer change. Patient has low BP, answer change. Patient is allergic, answer change. So that's why the this. But don't worry, again same thing. What I will do is I will first remove all of this. Clear? I will just tell you this. Up, down, L. Up, down, L. Up, down, L. Up, down, L. Then I will explain this. So slowly I will break it down. And this entire concept will become what? Much easier to understand. So forward, up, up, up. Forward, up, up, up. And ultimately you will understand everything in the end. So that is what I'm telling you. Please don't miss the medicine class. If you miss the medicine class, it will be a great injustice to all my hard work. So let's start. Neurons. What is the RMP value? It is minus 70 millivolts. What are the values? Minus 70 millivolt. Then comes skeletal and cardiac muscle. What is the value for skeletal and cardiac muscle? Anyone? What is the value? So skeletal and cardiac muscle, the value will be approximately, or how much? Tell me. Skeletal and cardiac muscle. Tell me. Minus 90 millivolts. Smooth, minus 50. These are the important ones. Others you can skip. So don't forget this. These are important. Others we can skip. Okay. Then RVC don't even have to remember. Forget, it's minus 12. Rods and cones minus 30 to minus 40 millivolt. Cochlea hair cell minus 40 to minus 50. You can ignore them, you can skip. Now let's come to the topic. RMP is a positive, negative value. Negative. So RMP means negative polarization at rest. Negative polarization at rest. So once again, what is RMP means? So RMP means it's a which polarization? Negative polarization. In which condition? In the resting state. So which state? In the resting state. You are having a negative polarization. Are you clear? Now, if it is negative, two changes are possible. Either it become more negative or less negative. So remember, if membrane becomes more negative. What is the English word for more negative? More negative. What is it called as? More. It is called as hyperpolarization. Are you clear? Hyper. So what the word polarization means? It is negative polarization, that is RMP. And what the English word for more is? It is hyper. So hyper means so what the hyper means? Hyper means more negative. Hyper means more negative. Are you clear? Clear? Done? Now, what is less negative will be called as, and if becomes less negative or positive, what will be called as? It is called as depolarization. Now, are you clear, bhai? Mono bhai, the name is Srinivas. Okay, Dr. Mano, are you clear now? So remember, it is not related to sodium potassium chloride. It is related to the membrane changes. If it becomes less negative, see again, what is polarization? Polarization just mean RMP. Less negative, we will attach the word less negative. We will attach the word D. D means less negative. Not. So let's revise. If the membrane is, let me ask you, let's say membrane RMP is minus 70 millivolt. So what will be minus 60 millivolt? Depolarize hyper. Minus 80 millivolt. Minus 90 millivolt and minus 50 millivolt. Just give me the answer, D or hyper. So what is minus 60? Depolarize. Minus 80, hyperpolarize. This and all you put the word pole. This is again hyperpolarized. This is depolarized. Are you now clear, Dr. Mano? Concept is clear. So remember hyper and D. Very good, very good. Okay, all of you, very good. Jimit, Pratik, Prabhakaran, Preeti, very good. FMG, yes. Dr. Riya, Preeti, Dr. Kana, Ishrat, Prabhakaran, Christy, Israt, very good. Shabash. So this is the concept. Okay. Now, how do you create this plus or negative value? The answer is it is through the stimuli. So this is the stimuli. So let's say you give a stimuli of minus 5. First, I'll write the values. Please focus on this diagram. I want all of you to get this clear. 60, sorry, minus 70, minus 65, minus 60, minus 55, minus 70, minus 80. Have you wrote this? Now tell me, if I give minus 5 or minus 10, what it become? It become minus 75, minus 80. That is more negative. That is hyperpolarization. So this is hyperpolarization. And if you would have given the reverse stimuli, just delete one of them. So if I give minus values, like I give minus, now I give plus values, plus 10, plus 5, it become minus 65, minus 60, which is less negative. So this is depolarization, less negative. So I hope everything is crystal clear. So membrane can shift from two values. Either it is more negative or it can become less negative value. So it can become more negative or it can become less negative. Yes, Dr. Akan, Mano, very good. So it can become more negative or it can become less negative. Okay. Now there's a magical value which is called as a firing level. Okay. Now it is minus 55, and what happens is if you manage to reach firing level, action potential occur. So depolarization, if we reach up to firing level, it's not tiring, it is firing level, it create the AP. So I'll write it here. So remember, if membrane reach minus 55 millivolt, called as firing level, action potential start. So what start? Action potential start. Are you clear? That is why depolarization is called as what? Depolarization is called as what? It is called as a excitatory. So who will create? So depolarization can trigger action potential. Called as what? called as excitatory potential. Called as excitatory potential. Whereas, tell me, what is hyper doing? Hyper take the membrane towards the firing level or away from firing level. Can you see that? Hyper take the membrane away from this firing level. Here. Hyperpolarization prevent. Hyperpolarization prevent action potential. That's why called as inhibitory potential. Are you clear? So let's revise it. Let's discuss because these are all important concepts and I want everyone to learn them properly. So let's continue. So first question. If membrane is less negative or more negative, what is less negative called as? What is less negative called as? Tell me, less negative. Less negative. Less negative. Less negative is D and more negative is high. Very good. Who can trigger AP? Who can trigger AP? Can cause AP. Action potential. That is why it is excitatory. Hyper. Inhibit the AP. Inhibitory. Option ma'am. Okay. Yes, you are right. Dr. Syed Atif Qadri. Very good. Dr. SS. Kanil Bhatt. Very good. Very good. Mano. Very good. Svenkat Sai Siva. Prateek Rajgupta. Christy. Priya. Volkan. Preeti. Kana. Ruchika. Mashood. Prateek. Akhila. Prabhakaran. Christy. Venkat Sai once again. Yes. So will you remember this? Because without them, you cannot understand the drugs acting on the brain. Okay. When I will tell you, the mechanism will be like, huh? What? Is this the mechanism? Thank you, sir. Now we are having good command over pharma of the drug which are anti-epileptic, then antiarrhythmics, then sedative, hypnotic. All these drugs act on the ion channel. If you don't know ion channel, how will you learn all these concepts? Are you clear? So that's why ion channels are very essential for you to understand and do. Clear? So let's continue and let's see the next concept. Now, depolarization at synapse by NT. What's NT is neurotransmitter. That's why the lecture is available in the app. You can watch it 10 times also. But if you don't watch it, it will be forgotten and then pharma become difficult. If pharma is difficult, medicine become 10 times more difficult. And that is the reason people have difficulty. So NT is neurotransmitter. NT is neurotransmitter. So first is depolarization at synapse is called as EPSP, that is excitatory post-synaptic potential. So once again, what is depolarization occurring at the synapse called as? It is called as EPSP. What is EPSP? Welcome, just check. It is available. Okay, please just check it now. It is available. Okay, clear? Maybe in the online batch class or maybe physiology batch class, it will be available. Just check it. Okay, I'm not joking. It is there. Okay. Chalo. So what is the excitatory? It is EPSP. Hyper is called as IPSP. Hyper is, yes, live section is there, not in the recorded lecture. Okay. Chalo. Done. Next question. What is hyper called as inhibitory? This I have discussed just now. Hyper is inhibitory and depolarization is excitatory. Now let's see the mechanism. So first understand the neurotransmitter when they are released from the synapse. This is the synapse. This is the presynaptic terminal which contain the receptor, this is presynaptic. They release the neurotransmitter and they bind to the receptor in postsynaptic. This is the receptor. So when the neurotransmitter is released, it binds the receptors and open ion channel to produce EPSP, IPSP. And remember, these ion channels are called as ligand gated ion channel. Okay, and they are ligand, that is neurotransmitter gated ion channels. Okay, and that is the case. And now let's see mechanism of EPSP, IPSP. So let's see mechanism of EPSP and IPSP. So what are we discussing? The mechanics or mechanism of EPSP and IPSP. Okay, pharma is in I think March, Feb end or March. Okay, now first is sodium channel opening. When you open the sodium channel, what will sodium do? It will come inside. So sodium enter the cell, and what that will cause? De or hyperpolarization? Depolarization, that is EPSP. Example is glutamate. Example is glutamate, and it is via what receptor? It is via NMDA receptor. So what is that? NMDA receptor, and it is the main excitatory neurotransmitter in our CNS. So who's the main excitatory neurotransmitter in the CNS? It is our glutamate. So it is what thing? It is glutamate. Okay. Then we have calcium channel opening. When you open the calcium channel again, the what will enter? Yes, the calcium will enter inside. So who will enter inside? The calcium. And again cause what? Depolarization. And example best is substance P. Substance P is the neurotransmitter for pain. So what happens? Whenever there's a release of substance P, like injury. So injury release substance P. Remember? Injury release substance P, and it will then cause the pain. How? Let's see. It stimulates the SG cells. What is SG cells? SG is the short form of substantia gelatinosa, and the SG cells are the first neuron of pain pathway. So who's the SG? First neuron of the pain pathway, and they will cause the pain. What are the other name for pain? Algia, algesia, or dolor. So what are the name? Algia, algesia, or dolor. So once again, what the terms are? Algia, algesia, or dolor is the word. So once again, what the term used? Algia, algesia, or dolor. Algia, algesia, or dolor. Understood, all of you? Now injury will release which substance? Injury. So injury will release what substance? It releases the substance P, which causes the pain. Now potassium channel, when they open, where will potassium go? Tell me, I have taught you already this thing. Where will potassium go? Anyone? Where will potassium go? Tell me. Very good. Potassium will go out. Yes. So potassium come out, and that will create D or hyperpolarization. Very good. That will create D or hyper. It's going out. You're losing plus. So you become more negative. Hyperpolarization. Call as what? Call as IPSP. That means it is inhibitory. Very good. I'm very proud of you all. You have finally understood the concept, because that is what the whole story is. If you understand, you are at par with NEET PG students, and that's why you will do well in your exam. So morphine will inhibit which cells? The SG cell, which is the substantia gelatinosa, and the receptor it uses is the mu opioid receptor, and that will inhibit the pain. That will inhibit the pain. So that is why it become inhibitory to the pain and cause analgesia. Why? Sg cell cause the pain, morphine via potassium inhibit the Sg cell, and the pain will be suppressed. Last one, if you open chloride, again where is chloride more? Outside, so chloride will come inside, again that will create less or more negative, more negative because it's already negative, that is hyperpolarization, that is IPSP. Example, glycine in the spinal cord, and GABA in the brain. GABA brain. So GABA will बंद करेगा brain. So GABA brain को ban करता है. So GABA is for brain. So what is GABA will shut down or inhibit? GABA will shut down or inhibit your brain. GABA brain. So GABA is inhibiting the brain. What is it? It is the main inhibitory in our brain. So who's the main inhibitory in the brain? It is our GABA. GABA. Are you clear? Done. So GABA is main inhibitory in brain. ठीक है? GABA. Now question is, now the drugs, let me discuss. First let's see summary and then we'll discuss. So GABA drugs like barbiturates and BZD. What is BZD? Benzodes. Benzoड है, benzoड करती है, दिमाग का benzo बजा देती है. Benzodiazepine. Benzodiazepine. Example, very famous drug, lorazepam. So that's why we give Lora to lots of patients who are having seizures or who are unable to calm down. तो उनको शांत करने के लिए, काम करने के लिए हम उनको लोरा देते हैं. क्या देते हैं? लोरा. So how to make a patient agitated, psychotic, not stopping? We give them single dose of Lora. एक लोरा in, all the person relax. ठीक है? तो उसको शांति पड़ जाती है लोराज़ेपाम से. Now how does lorazepam act? So it's a benzodiazepine. Stimulate, inhibit the brain. So they inhibit the brain. So they will inhibit the brain. That's why they cause sleep. So they are sedatives. Then they are anti-epileptics, because epilepsy is what? Brain is hyperactive. So they are anti-epileptic. They shut down the brain. Then they are what? They are what? Muscle relaxant, because they inhibit the brain. So muscle will not contract. Muscles are relaxed. Then anti-anxiety. Etc. So all of these are the functions performed by this. Are you clear? Done. Now second question. What will a CCB do? What is CCB? Calcium channel block. Does it excite or inhibit? Calcium. Tell me. It will cause what? Depolarize, hyperpolarize. So obviously it block, so it prevent the D. It prevent D. That's why it is inhibitory. That's why it is inhibitory. It inhibit heart. That's why it is anti-arrhythmic drug. Anti-arrhythmic. Class 4. So it is a class 4 anti-arrhythmic drug. So what is it? Class 4 anti-arrhythmic drug. Why? It inhibit our heart. So it becomes which drug? Class 4 antiarrhythmic agent. Are you clear now? Class 4. Then also it inhibit and relax muscles. Relax smooth muscles. So what it will do? Where? In vessels. So what occurs? Vasodilation. And if the vessel dilate, the pressure will decrease. Decrease BP. Called as depends. So amlodipine, nicardipine, so they decrease the BP, also relax the uterus, relax uterus, called as tocolytic. So let me explain. So what does the potassium chloride channel opener do? Inhibit the tissue. What do the calcium sodium channel blocker do? Prevent the D. So they inhibit the tissue like heart, neuron, brain. If they inhibit the heart, they are antiarrhythmic. If they inhibit and relax the smooth muscle, they become what? They become our which agents? They become our relaxing agent. So they relax the vessel, they cause the blood vessel to dilate, BP decrease, depend. They relax the uterus, they are tocolytic. So now are you understanding? Let me give a summary. So sodium calcium channel blockers, they are excitatory or inhibitory? Tell me. Sodium calcium channel blocker, are they excitatory or they are inhibitory? Tell me. Excitatory, inhibitory? They are inhibitory. So that's why they are antiarrhythmics, anti-epileptics, also relax the muscle. So they are inhibitory. Very good. They are inhibitory, not excitatory. अखिला ब्लॉकर है बच्चा, ब्लॉकर ब्लॉकर पूछा है. ब्लॉक करोगे तो क्या होगा? इनहिबिट होगा ना. So they are inhibitory. Example, they are anti-epileptic. They stop the epilepsy. Anti-epileptic. Clear? Next point. Blockers. Okay. Now tell me, what will a chloride channel opener do? Excite or inhibit? Chloride channel opener will excite or inhibit? Tell me. Okay. They are inhibitory. Very good. Depolarize कैसे हो गया अखिला यार? ओपनर है क्लोराइड यार, कैसी बातें कर रहे हो? If you open chloride channel, what chloride will do यार? Hyper नहीं करेगा, कैसी बातें कर रहे हो? It will cause hyper ना? Hyper करेगा. Hyper is what? Inhibitory ना? Make the neurons fire, muscle fire, contract or not contract, not fire, not work. Inhibitory है. Example अभी तो बोला आपको. Benzodiazepines, benzo, barbiturates, okay, lorazepam, diazepam. What they do? They open the chloride channel and they inhibit the tissue. Please don't make me disappointed. फार्मा आपका ऐसे निकलेगा, देखो ऐसे, ये फार्मा है ना, ये आपका ब्रेन है, ये फार्मा ऐसे जाएगा ऐसे, नथिंग विल एंटर. And if I teach you, I will make your understanding much bigger. And now the pharma will be here. अब बताओ, do you want pharma to be in your brain or not? So for that you need to learn what first? Physio. If you don't understand physio, how will the pharma teacher teaching you? The sodium channel blocker are antiarrhythmic agent, plus they are also acting as a nerve inhibiting agent, acting as local anesthetic. Spinal block, spinal सीधे epidural, वो सब निकल जाएगा. अच्छा, spinal block होता होगा, ए हो गया, याद कर लो. Sodium blocker is local anesthetic. Sodium blocker is antiarrhythmic. Which class? Class 1. बस लिखते रहो, class 1 sodium blocker. फेनिटोइन, वेलप्रोइट, समझ में कुछ नहीं आ रहा, नथिंग इज अंडरस्टूड, बस लिखते जा रहे हो कॉपी. दैट इज द प्रॉब्लम विद मोस्ट ऑफ द स्टूडेंट. दे जस्ट वांट टू राइट और मे बी लिसन एंड होप दे विल रिमेंबर. इंस्टाग्राम नहीं है बेटा ये, जहाँ रील स्क्रॉल करते रहोगे, है ना, हा हा हा, लाइक कर दिया, रिएक्ट कर दिया, शेयर कर दिया. भाई पढ़ाई है ये. क्लियर? इट नीड यू टू अंडरस्टैंड एंड पुट एफर्ट, सिट फॉर आवर्स, keep on doing it again till become a part of your memory. Clear? Otherwise the patient will also do, he will get apps, है ना, ऐसे आ जाएगा chat gpt medical version of chat gpt, and then chat gpt will be giving the diagnosis. Patient will open the chat gpt, start the video. अब तो वीडियो चैट आ गई ना इसमें, सो यू नो वीडियो चैट आ गई है इसमें अब. सो उसने ऑन किया एंड चैट जीपीटी को बता रहा है आई हैव फीवर. वो पूछेगा ओके विच ग्रेड, पुट द थर्मामीटर, देन हाउ मेनी डेज, 4 day, ओके व्हाट टाइप ऑफ फीवर, इट इज रिलैप्सिंग. वो फिर बोलेगा गेट योर टेस्ट डन, गेट टाइफाइड, गेट ब्लड कल्चर दिस, एंड कहता है यू हैव टाइफाइड, यू स्टार्ट द एंटीबायोटिक. अब क्या करोगे, क्या करोगे बताओ. क्यों? obviously if you don't work hard, this is going to become a problem. People are always, remember, nature will always kill its weakest members. Nature has no mercy, remember? So that's why a person who was working in postal department, or a person who did a course of what, telegram, yeah, ऐसे कर देते हैं, he was doing a radio repair course, so he was a radio technician. Do you think he has job nowadays? Postal department is all replaced. Now only Flipkart and all these things are there. Postal, Blinkit replace. Radio technician, that job is over. There's no radio nowadays. Phone has a radio. Clear? So that's why technology changes. You have to adapt with the technology. You have to adapt. For that, we need to be very strong. If you pass the exam now, become a doctor, become a MD soon, you will be in a position where you will be using the AI to treat the patient and manage them more efficiently. But if you are at the lower rank, not passing the exam, or you are at a just junior doctor, then a senior doctor will not need you. He say, I will hire AI doctors and they will manage the patient. I will do the surgery and final high level diagnosis or patient interaction. You people just, so that's what I'm telling you, okay? The only thing which can save you is your hard work, sincerity now. Otherwise, the time will be very difficult. Next 5 to 10 years are going to be very challenging. There are doctors increasing day by day. I think now the government has a scheme, every house one doctor, ghar ghar doctor. So every house one doctor. So they are planning to increase the number of seats of doctors to 2 lakh per year. So very soon you will be having, yes, 30, 40, 50 lakh doctors. Right now they are 16, 17 lakh. Very soon if they increase the rate of 2 plus FMG all, there will be more than 30, 40 lakh doctors. Population is this. So that means for every 300, there will be one doctor. Soon they will make it every 100% one doctor. Then every 1% one doctor. Okay. Then who will treat whom? भाई तू मेरा इलाज कर दियो, मैं तेरा इलाज कर दूंगा ना. So you treat me, I treat you. So that will become very, very, very difficult. So the only advice I can give you is still there's a window of 10-year window. Why? After 10 years, I think it will be very difficult for the jobs, for the placement, for the people who are entering this field, just like engineering, or especially now as the AI is becoming what? Coding, programming level. The basic level software engineers are now scared. What will happen to their job? They can't even change. Same way I'm telling you, saturation will occur. So that's why I'm telling you, work hard. This is your only time. Don't waste time. Okay, be sincere, be very, very, very hardworking. If you are knowledgeable, skill is there, you will be successful. No one can replace you. Okay, clear? Like this. Let's continue. Now let's see the AP. What is AP? AP is action potential, and it can travel. It can travel from. Can travel along now tracks, pathways, etc. Okay. Now comes all or none law. So the topic is all or none law. So the story about all or none law is basically AP follow it. AP follow it. And what it says? It says that either there will be full AP, either full AP or no AP or none. So if you give a stimulus, you will get the AP or there will be no AP, just RMP, no AP. So that means AP will occur if you give a threshold stimulus. If you give below threshold, no AP will occur. So right here, only threshold stimulus can produce AP. Okay, else there will be no AP. So this is called as all or none. Now comes the question AP in the neuron. Okay, so first is for AP in the neuron, we need to give stimulus, a threshold stimulus of plus 15 millivolts. So how much will be stimulus? Plus 15 first. It change RMP from minus 70 RMP to minus 55. Why? What is 70 plus 15? Minus 55. So that is called as threshold stimulus. And now 55 is called as what? It is called as the what level? Firing level. So what is firing level? Minus 55 is the firing level. Why it is called as the firing level? Anyone? Why are you calling it as a firing level? So let me explain. So it is firing level. Why? Because so it is firing level. Why? Because voltage gated sodium channels open. Okay. Now, as the cell open, there's a rapid influx of sodium. So sodium enter the cell, and as the sodium enter, it cause a very big positive value. That is plus 35 millivolt. This is called as overshoot or spike because above the value of zero also. So that's why it's positive. Now sodium channel close. This is the end of depolarization. End of depolarization. And now to repolarize, what open? Number 4. Potassium channels open. Where will potassium go? Potassium go out. That is efflux. And what will potassium efflux do? It bring the membrane. It bring membrane back to RMP. What is return back to RMP called? Return back. This is called as return, repolarization. So remember the word polarization means RMP. What the word re means? Re means return. So return is re. Please remember return is re. So let's revise it. Three changes. What is more negative? Less negative. Return to negative RMP. Basic concepts. What is more negative called as? Hyperpolarization. Less negative D, and return is return. D. Very good. Very proud. I know you all will do well. You will pass the exam with very good score, and start your internship PG preparation. Get into PG very, very soon, and then become a successful doctor before the lower level, entry level medical profession start facing problem. I'll give you example. Okay, a person who's working as a laborer, okay, will not be impacted by AI or any of this reason. AI cannot do digging, it cannot, like, do all the work of a laborer. It cannot be replaced. Okay, a nurse work is again difficult to replace. If you buy a, no, robot also, it will not be as easy to train, progress, and it is going to be risky. Okay, like you will never sit in a plane which is completely pilot free. Tell me, okay, is a plane without human pilot, without human pilot, only AI is running it, only AI. Will you travel in such a plane or not? My question, you humans will travel or you will avoid this plane? Tell me. Reason. Reason. Even if the AI is perfect, you don't trust a machine. It can become faulty, it can have some electromagnetic fear, some electromagnetic pulse, some short circuit of the chip, and it can give a weird result. So that is why never ever humans will travel without a human pilot. Even if it's just sitting, it is just the assurance there is someone you can talk to. And finally, that is why even if all the call center become automated by chatbots or this, still you need some human for the last level discussion or the talk. So that is why the last stage will always be human. So last step will always be a human. It cannot be automated. So my simple suggestion is yes, you will have AI for lots of things, but the human interaction thing will never ever be replaced. Can your husband wife be replaced by AI? No wife, no husband. AI wife. Do you want? Will you be happy? Tell me. Okay. And she never fight. This AI never fight. No cheating. Okay. Then yes, no cheating, no fighting. Okay. Then also no alcohol, no drinking. Remember all the birthday. Remember birthday, anniversary. Tell me, what will you prefer? A real husband wife or a AI which is honest, doesn't cheat, doesn't drink? Tell me, okay. I'm just giving you a perspective so that to decrease your fear and also give you an idea what future can be. We don't know. None of us know. Not so bad. Okay, chalo. Yeah, na? Okay, you can have, when these options come, you can wait, pros and cons, and then you can decide. Okay. Still don't want. Chalo. I'm just telling you, okay, how people can be sometime confused. Okay, chalo. Let's continue. Okay, let's continue. Okay, fine. So I think now you got the idea where I get these ideas for making the reels. So I just have to look at the real life situation and everything comes. Okay. Now comes the question. The question is repolarization. It is having two parts. Has two parts. I'll make a diagram also here. This is RMP. Okay. This is depolarization. This is re. This is spike. So depolarization and re. Now re has two parts. One is ER, other is LR. ER is early repolarization and LR is late repolarization. So it is early re and our late repolarization. Okay. Done. So early re is what part? It is near the spike. Late re is near, so it is near the RMP. So let's label it. So this part near the RMP is called as LR, late repolation, LR. This part which is near the spike, this part is called as our ER, that is early re. So please don't make a mistake. Early re is near the spike part, the late re is the part near this. Are you clear? So that is the story. Are you clear? Chalo. So now we'll take a break and then we will do the remaining part of the AP and the findings. So right now this is the diagram and I will make it later. Okay. Chalo. So let's continue the break. 20 minutes. 20 minutes. I will, yes, start at 5:20 p.m. So let's meet at 5:20. Yeah, we'll have the new link. Let's, okay.